Howdy! Managing multiple sclerosis is complex, and I find it most helpful to divide the management into three separate categories. In this video, I'm going to share with you our approach to MS and how we address each of those categories. If you're interested in better understanding how to manage a complex condition like MS, stay tuned, because that starts right now. Howdy! Thanks for learning about MS with me, Boster. I started this YouTube channel to help my own MS clinic patients learn between visits, and it's my hope that through these videos, I can help you learn too. Today's topic is the management of the complex condition of multiple sclerosis. It doesn't suffice to only approach the management of MS from one vantage point, and in fact, we find that managing it with three separate approaches works best. And so in this video, I'm going to share with you what those three spheres are. The first one is managing an attack or treating an attack. Now, an attack, a flare, an exacerbation, a relapse, they all mean the same thing. It's when you have a new focal neurological dysfunction. You've lost the ability to do something. You have a new numbness. You have a new loss of vision. You have a new clumsiness of your hand. And it sticks around for at least a day, oftentimes for weeks to months. We don't want attacks, and we use disease-modifying therapies to prevent them, and yet they can still happen. And when they do, we implore our patients, you have to call and let us know. Now, the 24-hour rule is a rule to live and die by. If you wake up and your hand's numb, and you shake it out and it feels better, you don't have to call me. If you wake up and your hand's numb, and the next day it's more numb, now I need a phone call. As a human being experiencing numbness, you don't know the cause. This could be a new MS attack. It could be carpal tunnel. It could be that you have a urinary tract infection that's short-circuiting your spinal cord. The bottom line is, we want you to bring this event to our attention so that we at the clinic can work it up. We'll check for infections, we'll examine you, and we can clarify if this is in fact an attack. Now, I have an entire video on management of attack, and I'll throw a link up above, and I'll include a link down in the description below in case you'd like to check that out. But in short, we can use lozenges and potions to help you hasten the recovery from your attack and get you better faster. After the treatment, we need to see them in follow-up. We traditionally have people come back after receiving steroids in 4 to 6 weeks, where we reevaluate to clarify if they've in fact gotten better or if they need another course of steroids or more therapy. That also is a point in time to discuss the success or the lack of success of their current disease-modifying therapy. Because if they had an attack while taking a therapy, that's called breakthrough disease, and that's not okay. The second area of management is treating symptoms. Symptoms are things that bother us. And people with MS can have a plethora of symptoms, from bladder urgency to frequent headaches, to cognitive fatigue, to motor fatigue, to a burning leg, to a clumsy hand when they're overtired. Symptoms are things that can ruin the quality of our life. And I like to joke with my patients that I have a pill for every ill. Now, that doesn't mean I'm going to give you a pill for every ill, because you're young and healthy and don't want to take a lot of medicines. And sometimes my pill comes in the form of an occupational therapist or a support group. Sometimes it's actually a physical pill that you take. The point is, if we keep your disease quiet by controlling your disease with modifying therapies, and in the process you're a miserable human being, we have not done our best job. In order to be successful, we have to both control your disease process and improve the quality of your life. The best way to improve quality of life is to manage symptoms. I'll give you my most favorite example, erectile function. I'm a big fan. Now, some men with MS develop erectile dysfunction. And if they do and it bothers them, I give them a little blue after dinner mint that improves Friday night. Treating erectile dysfunction with a medicine like Viagra doesn't slow down MS and it doesn't speed up MS. It improves the quality of their life. If a gentleman with MS has erectile dysfunction and doesn't care, we don't treat it. Again, the point here is to improve someone's quality of life. And I ask my patients, if you're having an ill, bring it to my attention. I will share with you 13 different things we can do to try to improve it. And then as a team, we can choose which ones you want to do and which ones you don't. The third category of management is arguably one of the most important, and that's disease-modifying therapies. Now, I said therapies with an S because in 2018, we don't just do one thing to slow down MS. We don't do 2 or 3. There's a minimum of 4 things that we want you to do to beat this disease. And I have a cutesy saying, I want you to be 4 for 4 in your fight against MS. What are those 4 things? Number 1 is to make exercise part of your lifestyle. I have several videos on the benefits of exercise, and of course I'll throw links up above and down below in case you'd like to check those out. The point is that people with MS that exercise literally slow the trajectory of their disease. They get worse slower compared to folks with MS that don't exercise. Number 2 is to not smoke cigarettes. Tobacco smoke increases the risk to develop MS, and if you have MS, it makes the disease move much faster. According to some studies, almost by 50%. The good news is, quitting smoking markedly slows the disease back down. And so not smoking is one of the important elements to success with managing multiple sclerosis. Number 3 is to supplement low levels of vitamin D. We check all of our patients' blood levels of vitamin D, and if it's less than 50, we supplement with vitamin D3. I'm not asking you to run to the pharmacy, buy a bunch of D3 and take it. I am suggesting that you talk to your MS provider to find out if your vitamin D is low, and if so, what supplementation will best serve you. Number 4 in our quest at being 4 for 4 is disease modification, taking a medicine to slow the disease down. Now, this video is not about which is the best medicine. The point here is you need to be on a disease-modifying therapy, and you need to be constantly evaluating it to make sure that it's working. There you have it, folks. In a quick nutshell, 3 spheres of management to optimize someone living with MS. Number 1, treating acute attacks when they occur. Number 2, managing symptoms to optimize their quality of life. And number 3, disease-modifying therapies, being 4 for 4 in your fight against MS. Not smoking, exercising, supplementing low levels of vitamin D, and taking an MS medicine and make sure it's working. Once again, my name's Boster, and thank you for tuning in to learn about MS with me. Today's question of the day: which symptomatic management has been the most impactful in improving your quality of life? Was it managing bladder, depression, spasticity, headache? Please leave your answers in the comments below. If you enjoyed this video and would like to see further videos from me, please take a moment and subscribe to the channel. You can do that by hitting that little red button. And until my next video, take care.